All right, so we're going to finish off discussing the autonomic nervous system, and then we're going to move on to the eyes, where we're going to finish our lecture for today. And the last lecture, we're going to talk about the sense of hearing, equilibrium, taste, and smell. So receptors for the neurotransmitters are going to be either cholinergic or adrenergic, okay? Cholinergic is always acetylcholine, so choline, acetylcholine, cholinergic. Adrenergic would be anything produced in the adrenals, which is epinephrine and norepinephrine. So the two types of acetylcholine receptors are the nicotinic and the muscarinic receptors. And they're both named after drugs that bind to them and mimic the acetylcholine effects. In other words, they're acting as an agonist. Okay, so they're doing the same activity that acetylcholine would at those sites. So nicotine would act the same way as acetylcholine on the nicotinic receptor. Muscarine would do the same thing on a muscarinic receptor, so therefore they get the nicknames or the names nicotinic and muscarinic. So, nicotinic receptors are found on sarcolemma of the skeletal muscle cells. So, they're the neuromuscular junction. Acetylcholine is released from the axons and it travels across the synaptic cleft, binds to the chemical gated channels, and it activates skeletal muscle contraction. So that is not part of the autonomic nervous system. It is actually part of the somatic nervous system. So it just shares that common receptor with the autonomic and the somatic receptors. So all postganglionic neurons of the sympathetic and the parasympathetic have them on their dendrites. So the postganglionic neuron, which is the second neuron in the two-neuron chain from the central nervous system out into the body, is going to have a receptor that is known as a nicotinic, so they all respond to acetylcholine. So that first neuron coming from the central nervous system will release acetylcholine. Well, the second neuron has to respond to acetylcholine, so therefore the postganglionic neuron will have the receptor that will recognize acetylcholine and therefore change its activity. And also, the hormone-producing cells of the adrenal medulla will have the receptor for acetylcholine, and it will cause a release of epinephrine and norepinephrine into the body, producing an endocrine reaction, which will be a longer-lasting reaction in the bloodstream, in the systemic circulation. So the effect of acetylcholine at the nicotinic receptor is always stimulatory. So in the skeletal muscle cells, you're always going to activate contraction. In the postganglionic neurons, it's always going to create an action potential to produce a signal from the first neuron to the second neuron to the target cell. And in this case with the adrenal medulla, it's always going to stimulate release of norepinephrine and epinephrine. So it opens the ion channels, depolarizing the postsynaptic cell. And I should say with one caveat, it has to reach the threshold, but it's always going to depolarize the cell, getting it closer to threshold. If it's a strong enough signal, it will create an action potential. So where are muscarinic receptors found? All effector cells stimulated by the postganglionic cholinergic fibers. So the effector cells, which is going to be the secondary cell of the two-neuron chain, okay, the ones that are stimulated by the cholinergic fibers. So if you have a parasympathetic neuron, it is going to always interact with a muscarinic receptor on the effector cell. It's not going to affect the sympathetic system, because the sympathetic system is going to be using epinephrine and norepinephrine as the neurotransmitter. So therefore, the effector cells will not have a muscarinic receptor, they will have an adrenergic receptor. So the effect of acetylcholine at muscarinic receptors can either be inhibitory or excitatory. It depends on the receptor type of the target organ, because in the heart, you're going to want a dampening of the heart rate, the blood pressure and the cardiac output. Whereas the stomach, you're going to want to increase the amount of hydrochloric acid being released, increase the amount of churning of these smooth muscles. So you want different effects. So in one case, you're actually hyperpolarizing the cell, and in the other case, you're going to depolarize the cell of the effector organ. Now, adrenergic receptors are going to be in two major classes, alpha and beta. So alpha is going to have alpha 1 and alpha 2. Beta is going to have beta 1, beta 2, beta 3. Don't care that you know the subtypes. Know that you know alpha and beta as adrenergic, but you don't need to memorize alpha 1, alpha 2, beta 1, beta 2, beta 3. That's all stuff you can look up at some point. I want you to get the big picture on what is happening at the adrenergic receptors. The effects of norepinephrine depend on which subclass of receptor predominates on the target organ. Again, when we have norepinephrine reaching different organs, you can have some that are going to depolarize the cell and create action potentials, create some change, and some that are going to hyperpolarize the cell, and it's going to actually bring it farther away from an action potential. Okay, so it depends completely on the receptor. I'm not going to ask you which one is going to be stimulatory or inhibitory. Just know that it depends, just like muscarinic. And so what I want you to understand is what organ is going to respond positively, create a stimulatory effect from the sympathetic, and what will create an inhibitory effect from the sympathetic, and vice versa for the parasympathetic. So knowing the heart, is the sympathetic going to increase or decrease the heart rate? Same with parasympathetic. Is that going to increase or decrease the heart rate? And it's opposite. So remember, which one would you expect to increase heart rate when you're running away from a lion or when you're trying to fall asleep? So some different drugs. So atropine, that's an anticholinergic drug. So it's going to be an antagonist to acetylcholine. So it blocks muscarinic acetylcholine receptors, which would then dampen the effects of the parasympathetic system. So it's used to prevent salivation during surgery and to dilate pupils for examination. So think about when you want to salivate. Are you salivating when you're running away from a lion or when you're about to eat? Well, of course, when you're about to eat. They've done experiments with Pavlov's dog where they actually are going to ring a bell and then put food in front of you. Well, then you get conditioned to every time you hear the bell, you start to salivate. Well, saliva is present to begin the process of digestion, and digestion would be part of the rest and digest response, and dilating pupils for examination. Okay, so that's going to allow for the body to relax and relax those muscles surrounding the eye. Neostigmine inhibits acetylcholinesterase that breaks down acetylcholine, used to treat myasthenia gravis. Now, myasthenia gravis is a disorder that is going to essentially not allow the muscles to contract. So when you inhibit acetylcholinesterase, you're inhibiting the body's ability to break down acetylcholine. So acetylcholine will sit in the synaptic cleft and continue to stimulate the chemical receptors of the neuromuscular junction. And if it continues to do that, it maintains that muscle closer to threshold. So it needs a smaller stimulus in order to create contractions. So here is one of my favorite ones to talk about. It is over-the-counter drugs for colds, allergies, and nasal congestion. They stimulate alpha adrenergic receptors. So what is an alpha adrenergic receptor? What neurotransmitter do they respond to? Well, they respond to the sympathetic system, right, and norepinephrine. So when you take these over-the-counter drugs, what are you essentially doing? You're essentially creating a sympathetic response. Okay, so you're taking your body out of the rest and digest response. Your body then masks these symptoms of of a cold, like the coughing, sneezing, the runny nose. Um, all those things are going to be inhibited by the sympathetic system, because if you're running away from line, you don't have the luxury of trying to heal the body and get rid of the bacteria or the virus or whatever it is that's causing those symptoms. You don't have the luxury of trying to fight off that if you're trying to first get away from the immediate danger that would be the Lyme. So the virus, the bacteria, those kinds of things the fight against them are lessened in the immune system with using those over-the-counter medications. So essentially what you're doing is you're masking symptoms so that you can get through the day, but you're delaying your immune system. You're shutting down your immune system. You're shutting down your body's rest and digest response for the short-term benefit. So it's kind of interesting when you look at that from that perspective. So essentially, people who take those medications all winter long, well, they are always sick throughout the entire winter. Whereas the people who are taking the day off, resting, relaxing, they heal, and then their body gets refreshed. They're able to go back to work in a day or two. So what about the beta blockers? Drugs that attach to beta 2 receptors to dilate the lung bronchioles and asthmatics and other uses. So it's stimulating again the sympathetic response so that you can open up the lungs, which will help asthmatics who have a difficult time getting air out. Okay, so there's other uses to beta blockers. Pretty much any time that you are trying to stimulate the sympathetic response. So the sympathetic response can be very useful if you stimulate it in the right modes, but you have to be careful with that. Okay, so controlling the autonomic functions. Okay, so you have the brainstem and the spinal cord are controlling a lot of the parasympathetic responses. Okay, because that's where you find most of the cranial nerves that are going to respond to or create a response to the parasympathetic system. So the hypothalamus is going to be the overall integration of the autonomic nervous system and the endocrine system. For a small little part of the brain, it does a whole lot. So if it's going to overall be the boss, it will send signals to the brainstem, causing a regulation of pupil size, respiration, heart, blood pressure, swallowing, all those different things. So it's creating that parasympathetic response in the brainstem. And then if you go into the sacral region, that is going to be urination, defecation, erection, ejaculation, reflexes. So that is actually something that I encounter quite a bit with little kids, is their sacrum is not fused yet, and so you can find that there's impingements on the nerve within the sacral region of kids who fall a lot, and that can create problems with night peeing. So urination at night that's uncontrolled, or kids that urinate in the middle of the day without having control over that. And it can also be problems with erection and ejaculation reflexes in adult males, as well as some issues with pregnancy or the cycle with adult females. So the hypothalamus can also control the limbic system and get input to and from the cerebral cortex. So cortical controls can still alter the hypothalamus function. And if you don't believe me, then try meditation, try yoga, try those deep breathing exercises. You can actually take your body out of that sympathetic mode and put it into a parasympathetic mode, or vice versa, by your thoughts. Okay, so have you ever been sitting in a room and thinking about something that happened in the past that was relatively traumatic? You start to create this new environment where your body goes into a sympathetic mode that creates this altered sense of this altered reality, essentially, where you're now creating a sympathetic response where your heart rate goes up, your breathing rate goes up, your digestive system calms itself down. So people who have anxiety and don't sleep well at night can actually have this, where they might be sound asleep, they have a dream about something, they wake up in the middle of the night and their heart rate is just out of control, their breathing rate is very high, and they have a very difficult time getting back to sleep because your body puts your hypothalamus, your cerebral cortex, and your emotions will put your body into that sympathetic mode where it feels like you have to be up and alert and ready for anything, and your body does not allow you to go back to sleep because of that. So let's talk about a couple of clinical terms, and then we're going to move on to the vision. Atonic bladder is the urinary bladder that becomes flaccid and then overfills. So you have two different muscles in your bladder, the trigone and the detrusor. And we're going to talk about those more next term when we get into the urinary system. But your atonic bladder is when it becomes flaccid, you don't have the input from the parasympathetic system to begin that process of urination, because urination is actually part of the parasympathetic system. It's the parasympathetic response. Your sympathetic system will cause you to hold urine in. And for some of you, you might think that that sounds backwards. But if you've ever tried to urinate with one of my favorite stories is my professor in grad school would tell us that he would allow students to go to the bathroom if during the exam, but somebody had to watch to make sure that they weren't cheating. So basically, he stood by the door making sure that they weren't getting answers or something. He said that people couldn't pee when they knew somebody was watching them in the middle of exam because they were already in that sympathetic mode, and then it heightened when somebody's watching them. It was a lot of people have that issue, and it's because you put yourself into that anxiety mode, that high, the state of high high anxiety, essentially. Okay, so Horner syndrome is going to be a condition due to damage to the superior sympathetic trunk on one side of the body. So your superior sympathetic trunk is going to be found around your first rib. So if you go to your clavicle on either your right or your left side, you go about midway through, and then you feel about half an inch to an inch posterior. You're going to feel the muscles of the scalenes, the first rib, and right in that area is where you're going to have the superior sympathetic trunk. And it causes a drooping eyelid on that side of the body, and it can be from a tumor of the lungs. So the tumors of the lungs, if they're in the superior lobe, can actually impinge on those sympathetic chains, and it can cause altered responses in other parts of the body, because that superior sympathetic trunk shares neurons to the eyes, and then also to the lungs as well, because it's coming from the upper thoracic region that are going to go up into the cervical region and above. Vagotomy is a cutting or severing of the vagus nerve. Okay, and this can be accidental during surgeries. It can lead to some issues with speech, sometimes with swallowing, and other issues with the upper digestive tract. So you might have some adynamic ileus with that, because an adynamic ileus is essentially the small intestines being shut down. A lot of times that happens post-surgery, and you actually stimulate that by heat pads on the stomach. So you can actually utilize these nerve patterns to stimulate the body to create a response and to start digesting again. So if you get the cutting or the severing of that vagus nerve, which goes to essentially the entire digestive system with the exception of the lower third of the large intestines, you're going to have some digestive issues. Vasovagal syncope would be common cause of fainting. It's due to a rapid drop in blood pressure, and if you have a rapid drop in blood pressure, it's typically stimulated by the vagus nerve, which is cranial nerve number 10, which is your wandering nerve, which is a good thing to remember because I've said that probably about 4 times now, that the vagus nerve is cranial nerve 10 and known as the wandering nerve. Okay, so that's what we're going to finish up for the autonomic nervous system. I'm going to take a break on the video here, and then we're going to start back up with vision.